active duty 23 years, and as a result, I have very good health care for the rest of my life. Another group that's very happy with their health care are those that are on Medicare. Both these are single-payer systems. I assume you want to get rid of Obamacare, but what are you going to provide that are going to provide people the health care coverage that I get?
What I believe is that everybody should have the ability to have the health care that they want. Not that the health care, you didn't mention the VA system, which is also a single-payer health care system, which my parents worked for. Well,
you don't fund it.
Yeah,
it's
well,
unpopular when the veterans come home from war and they're damaged. It costs money.
It does cost money, and I would make the argument that if you look at all of the other healthcare systems that are single-payer healthcare systems, they're not funded either. And there's long waiting lines. There's all sorts of rationing of care that goes on because the government has every government has a limitation. Medicare is very good, but it's also a system that has grown exponentially over the years, much faster than the rate of population growth within Medicare. So, I mean, I believe in what's called a premium support idea, premium support model, which is that, and I believe this not just for Medicare, I believe it actually for the private sector too. In this respect, it's similar. It wouldn't be the exact same thing. But the premium support model for Medicare is a model that says we're going to give every senior X dollars, and they're going to be able to go out and purchase the insurance product that they want. And there'll be a variety of different insurance products, different deductibles, different premiums, different co-pays, different benefits.
With a lot of overhead that they get to pay for.
With a lot of competition that will drive down cost of delivery, which if you're selling me the idea that the government is more efficient than the private sector, and in no place in America have we ever seen that. I mean, if you believe that, then we should be a socialist country and let the government run everything, because of course corporations aren't efficient. But of course you know that we have these cell phones. Why? It's certainly not because the government has designed these. Why? It's because competition has driven innovation, and innovation has driven quality, and has driven customer choice. And what you're suggesting is we need to take that out of healthcare, and that's a good thing. I think it's a bad thing. I think it's proven to be a bad thing. And the only reason Medicare and TRICARE are doing okay is because they have an engine of private sector healthcare that provides the innovation that they leech off of and that they're able to adopt. It's not because they're generating that improved efficiency and improvement of quality. So if we did what we did with Medicare prescription drugs, which is a premium support model,
It was unfunded when it was put in place.
No, it was not unfunded. We said we were going to fund it at a certain level. What is unfunded? Does unfunded mean that everybody should get whatever they want as much as they want? Of course not. Well, then what's unfunded?
The program when it was put into place, plus at 2 o'clock in the morning, Congress passed that, we can't go to the drug companies and negotiate with them for the price of the drugs. So that definitely drives.
I don't want the government negotiating with the price of drugs. I don't want a single-payer system. I don't want the government dictating prices. I want the private sector to negotiate. I want this plan. I want this plan.
You want drug prices the way they are right now.
I want drug companies to have to compete with different insurance policies to get either coverage or non-coverage. What I want is a system that drives innovation.
Drug prices in America.
Okay, I agree with that. But I want a system that drives innovation. And one of the reasons drug prices are obscene is because we have an FDA that makes it unconscionably long and costly to bring a drug to market. And so you can't complain about the drug companies who take sometimes 10 years to bring a drug to market because the FDA is making it so unconsciously expensive, and then say, oh, well,
I was prescribed an antibiotic. It's like 20 years old. It's a simple antibiotic. The company that made it sold the right to sell it to another company, and the price went up. When I priced it, it was like $120 for 3 days. It was a cheap drug. It was $10 for a 30-day prescription. This kind of thing happens over and over and over, and it is what happens when you have a system like we have, where the drug companies can essentially charge whatever
Why
they
can the
want.
drug companies charge whatever they want?
They can charge whatever they want.
How can they do that?
Well, first of all, they have.
Can
First
the
of all, they
farmers-
have.
Can the
They have
farmers
a
charge
patent.
whatever they want?
What's that?
Can farmers charge whatever they want? No, there's a market. And of course you have a patent, but you can only charge if people want what you have.
Are you saying there aren't drug prices that are higher than people can afford to pay?
Of course there are. But again, what's the reason for that? And if you say, well, look, we're not going to give drug companies a reasonable profit for the investment they're making.
Absolutely,
Great.
they're entitled to a reasonable profit.
Okay. And so when you're
Reasonable profit.
when you're investing in some cases billions of
I
dollars.
think you'll find that it is not a reasonable profit in any case. And you just simply have mergers, you have situations where companies are bought out by other companies. They pay an enormous price for it. They have to cover that in their drug prices, and they do cover it. This is the world that we live in right now, and it is not pretty, and it is not as good a world as it would have been if the government had had the ability to negotiate with drug companies over the prices under the Medicare program.
I think we just have a fundamental disagreement.
I'm sure we do. I'm sure we do. And I didn't really intend
No, that's okay.
to jump on your
No, it's okay.
case.
We have a fundamental disagreement as to whether the market works better or the government works better in allocating and driving down costs. And I think the government is a big part of the reason drug costs are as high as they are. And then that there's things we can do to lower drug costs by improving the FDA process. And I think most folks on both sides of the aisle actually agree with that concept. We just haven't been successful in getting that done.
That's a terrific idea.
Are there
Both sides of the aisle agreeing with this.
are there drugs that are
That's
ridiculous?
terrific.
Are there
As
drugs?
elected president, I certainly hope you succeed.
Well, one of the things I talked about earlier is I think we have a pretty good track record of that, of sitting down and trying to find areas where we can work together and be able to move the ball forward. Because I actually believe the president should lead and try to unite and try to get things done instead of just worrying about the next election and trying to win the next election.